Those struggling through addiction know that it's a journey to recovery, and having a compassionate and supportive partner is key. And that's what recovery medicine at Trinity Health Michigan offers. Dr. James Twested O'Toole is here to tell us more about the good work that they do in helping people recover from substance abuse and addiction. Good morning, doctor. Thank you for being here.
Good morning. It's a pleasure.
Let's talk about recovery, specifically recovery medicine at Trinity Health. What's your focus?
So recovery medicine is Trinity Health's brand of the specialty of medicine known as addiction medicine.
Okay.
And addiction medicine is perhaps not well known to a lot of folks. It's a relatively young specialty when you look at all of the medical specialties that are out there. And addiction medicine focuses on providing holistic care for the person with a substance use disorder. And so that may include somebody with an alcohol use disorder, an opioid use disorder, and we provide medication treatment for those conditions, as well as offering opportunities for behavioral support and lifestyle ways that they can improve their own condition.
Okay, you've mentioned a lot of things, so let's break down some of these. First, let's start with the medications. Okay,
Absolutely.
So that is part of the treatment for this, is medications. Can you talk a little bit about, I'm sure it's different for each, so what does that look like for someone coming in, say, with an opioid addiction?
Thank you for asking. So there are certain disciplines that approach a person with a substance use disorder, behavioral, for example, but where our specialty really shines is being able to offer medication support. So if somebody comes in and identifies as having an opioid use disorder, then we speak about 3 FDA-approved medications. The most successful that we have found, the game changer within the last few years, is something called buprenorphine, or the brand name for that is Suboxone, which many people may have heard of.
Okay.
And this is a product that can work very, very well to help people navigate through the withdrawal, which can occur within the first few days of stopping their opioid of choice. But then perhaps more importantly, it really helps them to maintain that abstinent state. In other words, it really does a nice job of addressing cravings so people can focus on rebuilding their lives. They can dedicate their energy to healing relationships and pursuing their professional goals. It's fantastic.
Many people who have suffered through addiction know that those cravings are real. That is a physical, definite issue that they are dealing with, and that medication is key. But there's more than that. You mentioned a holistic approach and the support. Can you speak to that?
Absolutely. So medication is perhaps the core of what we offer within addiction medicine, but at the same time, we recognize that just providing a medication for many folks may not be enough. They've been so devastated by the disease. They've lost relationships. They've lost jobs. They may have lost their home. And so we try to provide as many supportive resources in those other areas as well. So for example, we provide the physicians provide a little bit of light counseling, if you will. Mm-hmm. And then one thing that makes Trinity addiction medicine, Trinity recovery medicine unique is that we also have social workers and licensed practical counselors within our team, so they can really help patients work on the behavioral side of things. They can start addressing whatever the underlying concerns might have been that drove them to substance use in the first place.
Sure.
Help them with trigger identification, help them with craving management, and really just providing that perspective to start rebuilding.
And you're talking about, this is just a journey. Addiction, it's not like you're no longer addicted and you're done. It's kind of it's an ongoing journey the rest of your life, and you guys are there all the way.
It's an excellent point. Addiction medicine recognizes substance use disorders, aka addiction, as a chronic medical disease. So we will often say it's analogous to diabetes, for example, hypertension, or even cancer, meaning that this is a condition that a person will likely have for the rest of their life, but providing them with the tools and resources to be able to manage that chronic disease.
Absolutely. Don't want to take steps backward. We want to make sure that we're maintaining and moving forward. And this is all done outpatient.
That is correct.
So it's not like you're checking in and spending the night. And you can live your life, but living your life with that support, with that partner along with. So if you've got the great medication, you've got the great support, everything you need to help someone, I'm sure someone suffering this might go, "What can I afford it?" does my insurance cover this? Just talk a little bit about the cost of this.
Absolutely. So Trinity Health participates with all major regional insurance plans. I have not yet run into anybody who has been unable to afford our services, assuming that they've got some form of insurance coverage.
Absolutely. So this is part of your insurance coverage. You should look into that. And another question might be, do I have to have a doctor refer me? Do I have to have my primary care physician refer me to you, or can I just show up?
No, we really appreciate the referrals that we get from our primary care partners and even specialty colleagues, but at the same time, people are very welcome to self-refer.
Okay, so you don't even have to have that doctor's note, as it were, to get this care. Thank you so much for the time this morning, Doctor, for telling us more about recovery medicine. This is a big deal. Recovery medicine from Trinity Health Michigan can help those suffering through the substance abuse and that journey of addiction. You have to be at least 18 and older. You can self-refer. As you heard, most insurance plans are accepted. You can learn more at trinityhealthmi.org.